our Kickstart program, which is a 2-week intensive, hands-on, practical program that's actually run here within our clinic in Darwin in the Northern Territory of Australia.
This has been designed for new grad therapists and for therapists that want to branch into hand therapy and upskill in this particular area of practice.
Who can benefit from it are employers who might be looking at taking on perhaps a new graduate or a therapist who may not have much experience in hand therapy. Some of the really good things about the program are that it is actually a practical program. So it's a real clinic, they're real patients, they get real experience. They see the decision making, but really one of the big important things for us is that they see the clinical reasoning that goes on behind things. It isn't just a cookie cutter formula, particularly not in our clinic. That's not what we run. Clinical reasoning and using the most current and best evidence is a really big foundation of not just our practice, but this program. And we really have developed the resources based on that.
The idea for this program really came out of the number of people that we had contacting us, both of us, over the last 4 or 5 years, who have wanted some help to get some experience, to know where to go, to get some advice about getting into hands.
I built the RehabMinder hand therapy app after my own experience of being a patient and realising how hard it was to do a home program. I wanted to be able to give my phone to my therapist and for them to set up my exercises and then for me to go away and be reminded to do them. From a therapist perspective, I wanted it to be really comprehensive, and after I'd done the first draft of 330 something exercises, I realised that it had to be quick to set up as well. So we made more databases, and now the therapist chooses an injury profile. So it's made up of a body part and a description of the injury. Then that generates a short list of exercises for the therapist to choose from. In 2014 we brought out version 2 of RehabMinder. We split the installation into a free and a paid premium installation so that it did away with the need for a Wi-Fi connection. We added more exercises and we included the functionality to be able to send a summary of the therapy program to a clinic email address so that it can be attached to the patient's notes. I love the potential that RehabMinder has. One day I'd love to see it be built for Android and be used as a source of valuable data collection on how mobile health can affect behavioural change.
Welcome to Rewired Hand Therapy. These are our East Melbourne rooms. We're based in Victoria, Australia. We are really excited because we've been nominated as a finalist in the Geach Innovation Awards for the hard work that my team and I have been putting into the brachial plexus injury patient population. We had to address the problem of treating patients from remote areas as far and wide as New Zealand, Northern Territory, Tasmania, just to name a few. The relatively few therapists that are out there who are doing the treatments for these post-op procedures has meant that we've tried to develop a system of being able to communicate information more readily to both the patient and to other therapists, as well as create a package that can also be used for assessment when patients come back, because they come back to see us maybe every 6 months, and then we can update their program and their home exercise program based on the results of the assessments when we see them. So what we have designed is a poster, which is one part of the program. The poster is just a really large-scale education tool that can be used with the patient. It allows us to clearly explain to a patient what level of injury they've had, and what nerves have been completely wiped out or lost, or which ones have been transferred. So when a patient first is referred to see us, we will sit down with them and draw on their handout what their injury, what level their injury has been and what nerves have been lost because of their injury. Then following every operation, because they usually have subsequent reanimation procedures, following each one of those we will document those on their handout by showing them which nerve has been transferred to which, to reanimate which muscles. This gives the patient a visual understanding of what's gone on, but it also gives them a map at the end of all of their procedures so that they can take that with them to another therapy centre or back to their family, so that they can have something in front of them when they do call us for information or ask for further assistance. In addition to this, we have designed a table which lists in a little bit more detail the procedures, the surgical procedures, and the best way to describe it is the best outcomes expected from those surgical procedures from a therapy perspective. So that a therapist has a quick review document to basically pull it out when you're with a patient, or if you're on the phone to a patient, you can have a quick check to see exactly what's gone on and what you're expecting to return at what time frames. We've then taken this process to the next level and designed exercise package sheets and handouts for patients to take with them, and we've matched those up to different levels of manual muscle testing groups. So of the 5 levels of manual muscle testing, each patient gets a different exercise pack. So they have goals, and then they know what they're working towards as their muscle gets stronger, and it just helps to keep them motivated after over such a long period of a rehab process. Tailoring the handouts into video footage that is being linked at the moment to our website, so that patients can have their own login code, log into the website and get onto their specially structured exercise program with video examples of those exercises. So when they're doing them remotely, they can log in and just double check that they're doing them properly.
Hi, I'm Hayley. I'm one of the hand therapists at Rewired, and this is Ali, one of our patients. He's had a complete brachial plexus injury. He's also had a number of re-innovative surgeries.
I reckon it's great because you understand what nerves do what, and when you have surgeries, you get told what nerves will be connected to different muscles.